this from the ground upwards.
Do you need to take that?
Yeah, definitely don't let
I don't want the statistics to go wrong.
Keir Starmer went to Epsom Hospital to give his big speech on bringing the NHS back to health. He said the country's most important institution is in a chronic condition.
The feeling of record dissatisfaction that we now see, millions of people waiting on waiting lists, their lives on hold, the potential, if you like, of the country blocked.
John Winnick had a 7-year fight just to get on the waiting list for hip surgery.
Yeah, so here are my golf clubs. I used to play 3 times a week, sometimes more.
Arthritis left him unable to get out of bed, let alone play golf. When John was eventually referred for surgery, the predicted wait was more than he could physically bear.
The pain was there constantly. I was surprised it was 65 weeks, which had just been brought down from 75 weeks. Paid into the system, paid it, all my contributions for 50 odd years, and then to virtually beg for having something done and being put on a waiting list and not being seen, it's a sad state of affairs.
John voted with his feet. He paid £9,000 to fly to Lithuania for surgery. The 6 million people still waiting are promised a new era of quick, convenient appointments. Community diagnostic centres will be open long hours, 7 days a week, so people can have tests and scans around their daily lives. Thousands will get a same-day service with follow-up consultations on the same day as their checks, so they can start treatment quicker. For those who need straightforward operations like hip and knee replacements, 14 new surgical hubs will open by the summer with ring-fenced beds which can't be used for other things like flu outbreaks. The government says all this means 65% of non-urgent patients will be seen within 18 weeks by March 2026, and it will meet the 92% target by the end of this Parliament in July 2029.
I think it would need a fair wind behind it if the government was going to achieve its ambition. I mean, when I look at this plan that they've published today, there are a lot of good initiatives in it that will help make a dent in waiting lists. But you would have to hope that all of those can be achieved and you avoid things like another pandemic and that you avoid further industrial action. So basically, you really do need everything falling for you to achieve this plan. And I think that's quite a big ask.
The Prime Minister announced more NHS money will go to private hospitals with a focus on gynaecology and orthopaedics.
I know some people won't like this, but I make no apologies. Change is urgent. I'm not interested in putting ideology before patients.
Doctors and nurses leaders are pleased the plan's so ambitious, but have reminded the government that without more staff, recovery will be slow.
Well, earlier I spoke to the Health Secretary, Wes Streeting, about the plans announced today to bring down waiting lists and the comments by Elon Musk. I began by asking him whether they've got enough staff to deliver their NHS goals.
The crucial thing about today's plan, it's been launched with the NHS, in partnership with the NHS. We've signed up to this together and we've made a number of commitments together to deliver not just the investment of the budget that was very welcome, but also the reform that the Prime Minister, the Chancellor and I all promised.
You know, you promised a 10-year plan on the NHS. So far, you've launched a national conversation. You promised to fix social care, and you've now launched this commission, which won't report until 2028. You've been in your job as Shadow Health Secretary before your current job since 2021. Why didn't you come into office with a ready-made plan for both of those things, social care and the NHS? Could have got moving quicker.
Well, we did, and that's why we've hit the ground running. We promised
well,
to...
Have you?
Yes.
It's 6 months since you took power.
We came in, we've hit the ground running. Within 3 weeks, we'd ended the junior doctors' strikes with a new resident doctors deal, which means this winter staff are on the front line, not on the picket line. Within weeks, we came in and found the funding for an additional 1,000 GPs to be employed on the front line by this April. Hundreds already recruited, the rest to follow in the coming weeks. It's why the Chancellor put in almost £2 billion to deliver on the first step we promised of ramping up those 40,000 more appointments, 2 million more appointments a year to cut waiting lists. People will be able to judge in July, the first anniversary of the Labour government, whether or not we delivered on that pledge, but I can tell you've been ramping right up to deliver it, and I'm confident we'll get there.
But social care,
and even on
the social care
yeah,
Commission won't report until 2028. You're not hitting the ground running on that, are you? You could have implemented one of the other reports, many reports that have been launched before on this.
I'll tell you why the Commission's important in just a moment, but we have hit the ground running on social care. First 100 days, we legislated for fair pay agreements to deal with a workforce crisis. The budget delivered the biggest expansion of carers allowance for unpaid family carers since the 1970s.
There's tinkering around the edges, all of that.
No, tell that to family carers who are getting an extra £2,300 a year.
The NHS isn't the one making the headlines today. Your plan isn't grabbing the headlines. It's Elon Musk doing that. Keir Starmer talked about the lies and disinformation that are being spread on the child grooming scandal. Do you think that Elon Musk is using hate speech?
There's been far too much focus on a guy in America who doesn't know this country, doesn't understand what's going on in terms of child sexual exploitation. And I think we should just all take a step back for a moment and reflect on the fact that these are some of the most appalling, sickening crimes imaginable. And we've got, in Downing Street and in the Home Office, a Prime Minister in Keir Starmer and a Victims Minister in Jess Phillips, who before they entered Parliament had given their lives to fighting violence against women and girls, who have locked up together, Jess supporting victims, Keir as a prosecutor, paedophiles, rapists and sex offenders.
Well, you've talked about Keir Starmer and Jess Phillips' efforts in this area. For their pains, Elon Musk called Jess Phillips an evil witch, a rape genocide apologist who should be put in jail. He said that Keir Starmer should be in jail. Is that hate speech?
It's certainly an appalling smear in Jess's case, and it is absurd in terms of what he said about the Prime Minister.
You've said, and the Prime Minister said, that he's crossed a line. Therefore, why don't you do something about the fact that he's crossed that line and prosecute him, use the existing laws on hate speech?
Well, I'm not a lawyer, and I'm not qualified to judge whether he's broken the law or not. And to be honest, I've spent most of my time in recent days thinking about, and by the way, I'll be spending all of my time in the coming weeks and days thinking about how I can turn the NHS around to build a social care system fit for the future.
Are you reluctant to say it's hate speech because you're worried about upsetting the apple cart diplomatically? This is a very important member of Donald Trump's cabinet.
No, I think I've been pretty robust over the weekend and just now in terms of what I think about his comments.
Well, on Friday you said you're willing to work with Elon Musk.
Well,
He's got a big role to play. If he wants to work with us and roll his sleeves up, we'd welcome that.
I think you know, if people who saw that, I think it was very clear the tone in which I was saying, look, it's all very well taken to Twitter. If you actually want to do something about victims of child sexual exploitation and abuse, clean up your own platform. There are things that
you're willing to work with him to do that still, are you?
There are things that social media companies can and should be doing, and in some cases are doing, to clean up the internet. There's more to be done, but closer to home, we're focused on victims and delivering justice for victims and protecting and preventing future victims.
One final one on that very point, because Keir Starmer himself says that too many victims were let down in the grooming scandal. Did previous Labour governments, Labour councillors help foster that climate of political correctness, concern about political correctness, and that prevented the perpetrators being brought to justice swiftly, that climate? Would you accept responsibility?
There was definitely a problem, which actually Louise Casey, when she did, I think, the Rotherham inquiry, exposed that there was a climate in which people were afraid to speak up for fear of being accused of being racist, and were afraid to speak up or act because of fear of upsetting community cohesion. And the Prime Minister was absolutely unequivocal this morning. That is a warped view of community cohesion that he has got no time for and this government has got no time for.
But previous Labour governments did foster that.
But there's no doubt that under successive Labour, Conservative governments and Labour and Conservative administrations at every level of the country, that victims were let down. There is no doubt about that. If there's one thing that we can do now to try and correct past wrongs and injustices, it's to deliver justice for those victims and to demonstrate through action that we are doing everything we can to make sure that we don't see a repeat of those sorts of heinous, sickening crimes.
Wes Streeting, thanks very much.
Thanks a lot.
Well, we did ask to interview a Conservative shadow minister about Elon Musk, but no one was available.